Hi, everybody. Welcome to Venice Family Clinic's Zoom meeting with you today. We appreciate your spending time with us and being our supporters during this very difficult time. Today, we're hosting a discussion about Venice Family Clinic's response to the coronavirus, which is also referred to as COVID-19. I'd like to start by introducing myself. I'm Liz Forer. I'm the CEO at Venice Family Clinic, and also introducing my colleagues. Anita Zamora, our Deputy Director and Chief Operations Officer, and Dr. Despina Kayichian, who's our Chief Medical Officer. We're going to start with an overview of how Venice Family Clinic is currently operating, and we will also answer questions that we've received from you prior to this meeting. So I'd like to kick it off by thanking our entire team. We have an incident response team that both Anita and Despina are part of, and they meet every day at 8 a.m. and often then with other teams at 12:30 and at 1, and in between we're shifting everything and making sure we're caring for our patients. At Venice Family Clinic, we are open to the community we serve every day, and that is about 28,000 people with low incomes, and that includes 4,500 homeless people. As of March 18th, we have dramatically shifted our services. Our priority is to continue to provide access to healthcare for all of the people we serve, while ensuring their safety and the safety of our staff. Many of the people we serve, as you know, have very low incomes. They're losing incomes now, and also many of them are seeking shelter, such as our homeless clients. Our role as a community health center means that we will treat the patients who don't need to go to the hospital, and therefore that will help us alleviate the pressure on hospitals for the people with COVID-19 who will go to the hospitals. We are going to provide essential primary care for our low-income patients throughout the coronavirus. And for those who need treatment, we will make sure that they are seen at the hospital, and when they're discharged, we'll continue to see them. Our shift in services has been dramatic. For the safety of our patients and our staff, we've switched mainly to phone visits. At this time, 65% of our patient visits are now on the phone. As part of this shift, we also looked at all of our routine and preventive visits and really tried to either push them back or switch them to phone visits. So our physicals and our well child checks, many of them have been moved back a little bit. For things that are more urgent, such as immunizations for children under 2 and prenatal care, we've adjusted and adapted how we do those visits. I'm going to toss it now to Anita, who will tell us more in more detail about the response of our clinic to all of this that's been going on in the county and in our city. And she's been very attuned to the county public health updates and working with Despina on creating incredible protocols. So Anita, why don't you go ahead and tell everybody more about the services of what we're doing differently.
Thank you, Liz, and thank you everyone for joining us today. So as you mentioned, we have worked really quickly to modify almost every aspect of our operations in response to the coronavirus outbreak. We've made significant changes to how we deliver services in order to meet our goals related to being safe and following safer at home orders, while also maintaining access to all of our important services for our community. So as you mentioned, Liz, we switched as much as can be done well over the phone, and also pushed out more routine services by a month or 2. And we still maintain face-to-face for essential high priority services. So I'll give a few examples, some highlighting some of our services. As you said, the majority of our primary care visits are actually now over the phone. We still have dental care for urgent needs, such as a broken tooth or severe pain, but routine visits are on hold. Much of behavioral health is conducted remotely, like with therapy sessions, but we also have therapists available here on call to address mental health and other psychosocial needs of our patients that always come up, but especially now can be more on the forefront. In Early Head Start, we've modified some of our programming across the family-based and center-based services, still actively providing those, but have introduced some phone and Zoom visits in addition to in-person. We canceled all of our group visits and classes. That was mid-March. but we still continue to offer those services in other ways, either virtually or in person. So these are things like our substance use services, prenatal visits, chronic disease management. I also want to note that we still have our food distribution program in place because food security is more important now than ever, as there are so many people facing income insecurity and difficulties in obtaining food. And also, in addition to the changes in our services, we're seeing a large increase in activity over our phones. Our call center is busy, and even busier is our advice line. So the advice line is staffed by nurses and other medical providers, so they can screen patients for symptoms and assess if they should be getting tested, if they need to come in, or they need to seek care in the emergency room. So it's an advice and triage function. And as we've done for 50 years, we continue to serve those most in need. And that's why we have very strong protocols in place to keep our patients and staff safe and healthy in the face of coronavirus, and have figured out how to continue to provide these comprehensive services.
Despina, share with us more about our protocol for testing for coronavirus and what the criteria is for the people need to meet to be tested.
Hi, thank you, Liz, and hi everyone, and thank you again for spending this time with us. So our testing protocols are currently based on the guidelines that we adopted from LA County Department of Public Health and the CDC. Now we'll mention here that those guidelines are and really it's a dynamic situation. They have been changing depending on the need and the availability of the test. Therefore, we are in continuous search for the most updated guideline from those organizations. So currently, as of today, the criteria are: we test if the positive test change management, right? And we test if knowing that the patient has positive COVID disease will pose a public health risk. So this means we also test for moderate disease and high risk patients. So this combination puts the patient at risk for clinical deterioration. So we do want to know that. And chronic disease patient and high risk patient are patients who have, for example, diabetes, hypertension, patient also who are older than 65. Our healthcare workers are in that category. We do want to know if they're positive for COVID-19. And also patients living in a group setting like shelter. And patients who have moderate disease like fever and respiratory symptoms, so they do qualify for testing at this time. Home instruction, I will note, it is similar to both patient tested or not tested. And why is that? Is because currently with the community spread that we have the situation in LA County with COVID-19, we actually assume that any patient with respiratory symptom will have COVID-19, whether tested or not. So with that, we are able to do testing on site for people who meet the criteria using testing swabs provided by our partner Quest, and have also other options coming online. Otherwise, patients with mild and moderate symptoms with no risk factors would be managed with home isolation instruction and with self-quarantine instruction given to their close contacts. We are able to manage many patients over the phone and have finalized this week a process that allows us to follow up with patients who either had a phone visit or a face-to-face visit and are at risk for clinical deterioration, as I mentioned above. We screen everyone who come to the clinic, whether scheduled or a walk-in, for possible symptoms of COVID-19. If they have symptoms, then we immediately bring them to an isolation room. Then a nurse and a medical provider will wear protective equipment and provide further assessment and determine if a patient needs testing and other care. We also make sure to give them home instruction, like self-isolating for 14 days and a supply of masks. For our patients who do not have access to food or shelter, we work with our case management team to get them connected with what they need. As of today, we have tested 17 people with 15 results that are negative and 2 pending. Currently, it's taken about a week to get results back. However, as lab capacity changes, we hope these results turn around more quickly. Thank you, Liz.
You're welcome. It's been really heartwarming to get questions from all of you asking how our healthcare professionals are doing. And Anita, I'd like you to share more about what it is that causes our staff to come to work each and every day during this crisis.
Right, and you know, as Despina talked about, we have practices in place to protect our patients, but they're also in place to protect our staff. And so we're making sure that our staff, in addition to some of those infection control protocols, are able to practice safe social distancing, a term that we're all familiar with these days. We've done things like create alternative lunchrooms, support remote work. We actually have a significant number of staff working remotely. We provide more space in communal areas like offices and charting rooms so people can space out. And of course, still our staff, like many of us, are understandably concerned that they could contract coronavirus, they might become sick, and they might expose their loved ones. But people who come to work at Venice Family Clinic are committed to helping the most vulnerable, and our staff is still very driven by our mission despite all of the current challenges. And I think that's apparent as much now as it has ever been.
Despina, share with us more about the personal protective equipment that our staff needs.
So as you know, personal protective equipment, or PPE, includes items like masks, gowns, gloves, goggles, and face shields. We do have some PPE. Our team has been actively sourcing them, and we have had some generous donation as well. But we still need more. We are coming up on a surge, we think, and therefore we are still taking donation to anticipate it, to anticipate the surge. We are in need of surgical masks, goggles, and face shields.
One of our most vulnerable populations are people who are experiencing homelessness. In general, people who live outdoors have a greater health risk than people who live inside. Thus, every person who is homeless in Los Angeles is at greater risk. Let me share more about our services for our homeless clients at this time. At our 604 Rose Avenue location and at a clinic that we have at the People Concerned Access Center, we are able to continue to provide the full range of care that we've always provided to our homeless clients. We also just recently started having our medical team go to the new Bridge Home Shelter in Venice. Initially, a few weeks ago, we pulled back our street medicine teams while the People Concerned and St. Joseph Centers, our two key partners in housing and care management, also were pulling back a bit. And then after we all took a bit of a breath, everyone began going out back into the field. So we are putting our fields back into the team, back into the field in the next week, and we'll slowly be doing that again. Mayor Garcetti has done something astounding, which is he's been able to secure 1,000 tests a day for people experiencing homelessness. And I'm really proud to share with you that Venice Family Clinic has been designated as a testing site for the entire West Side, which is Service Planning Area 5, for all of the homeless on the West Side. And just this morning, we had 150 tests delivered to our front door, and we're very excited about this opportunity. We are starting to set everything up, so next week at Rose Avenue, we'll begin offering these tests to our homeless clients, and then the street medicine teams will go out the week after. We are also coordinating with 3 new shelters that began operating last week. And the registered nurses who work at these shelters will be really focusing on coronavirus and have asked us to come in to provide more of the ongoing medical primary care that we're accustomed to doing with our homeless clients. The shelters are located in Century City, on Sepulveda Boulevard, where the rec center is up. It's fairly close to UCLA, and in Westchester, right behind Councilmember Bonin's offices. I know that there are many concerns about whether homeless people will be able to shelter in place and if their accommodations will allow for safe social distancing, and Despina will share more with us about that.
Yeah, we are all certainly concerned about our patients without homes. The landscape of transmission has shifted significantly the last few weeks, and with the prevalence of community spread in LA County, it is imperative we offer isolation and quarantine sites, as well as testing availability to the most vulnerable population. What is being implemented in Los Angeles City and County are swift measures to mitigate this risk. In addition to the testing and isolation sites, making sure that patients who experience homelessness are able to perform hand hygiene is also being addressed. As far as the higher risk of complication, think about who is currently at high risk for complication. Patients with diabetes, hypertension, congestive heart failure, liver disease, asthma, patient older than 65. Our patients who experience homelessness suffer from a higher prevalence of poorly controlled chronic disease and chronic condition, whether from their untreated hypertension or poorly controlled diabetes or chronic liver disease due to their substance use disorder. So this highlights the potential worse outcomes, unfortunately, from COVID-19 this population would suffer if we don't immediately take proactive actions and measures to mitigate that risk. So what's currently being done, and Liz mentioned a little bit about it earlier, that the county is working to put online 900 places for people without housing to isolate and self-quarantine. These include hotel rooms and trailers at Dockweiler. And more services are being placed on the streets, including more hand washing station, toilets, and attendant and shower and services. People living in tents are being encouraged to shelter in place or to seek help at the shelters Liz mentioned previously.
Anita, you mentioned earlier that we're continuing our food distribution. A common question is if we are seeing more patients who cannot afford food, and how are we helping them?
Yeah, so as many of you might know, one of our priorities at Venice Family Clinic is food insecurity because it's directly tied to helping our patients be healthy. It's also, as you know, considered an essential service right now. So we always do biweekly food distributions with our partner Food Forward to hand out fresh produce, and we're continuing that. And we're aiming to do this more frequently, at least weekly. So recently, we've also begun to get some more shelf-stable food from the Westside Food Bank, which is especially relevant right now as people are being asked to stay at home or they might need to self-quarantine. And in order to be able to continue to provide this much-needed resource and keep people safe, we put in a number of practices in how we distribute food. So like we've often done in our history, we've literally thought outside the box. We changed our processes and pre-bagged the food so that we could deliver them to people to their cars or by easily practicing social distancing with a queue system. So each bag has about 20 to 25 pounds of food. And at our last event, we had a record-breaking distribution and handed out 506 bags of food, and we're expecting that to be even higher next time. So as I said before, now more than ever, with patients being laid off and losing income, our patients need this program.
Despina, with the increase in phone visits, how is it that the transition to telehealth and phone visits is going?
Yeah, I am happy to report that our medical providers and our behavioral health providers and all the providers who are performing phone visits are embracing the use of telehealth. They feel great about this transformation because they understand its value in improving their safety and the safety of their patient. And here at Venice Family Clinic, we have always done phone visits for some of our chronic disease patients, including diabetes and chronic hepatitis C disease. So for this reason, we were well positioned to transform our operation overnight, frankly, from face-to-face to telehealth. Our providers as well have had the tools. So they've had their laptops set up for remote work already, and the ones who do street medicines have already gotten company phones to help them do their job. So thanks to our IT team, this process was seamless. But we also have the experience, and Liz referenced the dramatic increase of uptick in phone visits. And with that though, knowing that I'm hearing great positive feedback from both our clinician and our patient. And I would like to just take a minute, actually less than a minute, to share with you a couple examples from my patients. So the first day or two, I called the patient to say, hey, Mr. Smith, I'm calling you to tell you that we're actually, you're not seeing me tomorrow. You're actually, I'm actually calling you on the phone. And he actually didn't allow me to speak. He goes, you're gone from the clinic. I said, Mr. Smith, I'm calling to tell you that we'll be doing phone visit. You don't have to come. It was like he didn't allow me to finish because he was so anxious that I'm telling him you need to come to the clinic. So our patients really a sigh of relief when they hear that it is a phone visit. But as much as our population and our patient population is diverse, also is diverse the way they are viewing the threat. The other day I was calling a patient who struggled with high blood pressure and chronic kidney disease, and my patient as a nephrologist are the most vulnerable patients. So I'm asking how he's doing, and he said he's had a little bit of shortness of breath. So I'm getting a little bit to understand if he's exposed himself to anyone with COVID-19. And he goes, yeah, the daughter of the lady that I'm friend with is sick. And I said, wait, the daughter, are they actually living with you? He goes, no. So then I realized that he really didn't understand the concept of shelter in place. So we needed to go over that. So those two examples really highlight the diversity of our patient population, how we as a clinic are adapting our advice to those patients accordingly.
I'd like to address how we're building our capacity for a coming surge in corona cases. So we have been planning quickly but carefully to anticipate an increase in demand for care. And we've developed several scenarios to help us be ready to deploy our staff and our volunteers to meet the capacity needs that will occur. We've been maximizing our exam room capacity by doing the phone visits. So right now, on any given day, we actually have exam rooms that are standing empty because 65% of our visits are phone visits. We're also using alternative spaces for patient screening and care. So we have plans to use both tents and to work inside of our parking lots, especially the ones that have overhangs, to create additional space for our patients. We've been doing our best to purchase and obtain adequate supplies and equipment. I had a good talk today with UCLA around how they can help us with this, and they gave us some good advice in terms of how we should stock up and what we should expect. We've developed many clinical protocols and workflows. There's a dizzying array of charts that we look at every day and adapt and adjust, but it's helped our staff be nimble. We've now grown accustomed to daily change, and I think that will help us as we move into a surge. Many of our staff are available and able to serve at a variety of alternative roles. So for example, our dental team is helping us do screening at our doors and to help screen our staff as well as they come and go from work, and have been reassigned since we don't have that many urgent dental needs right now, and the preventive care is postponed. We're also fortunate to have several physicians and other clinical providers who've offered to volunteer with us when they are needed. So we're hoping to get them trained up in the next couple weeks so that they're ready to help us as more people need our care. An important dialogue we've been having has been with each of the hospitals that are our partners, UCLA, Cedars, St. John's. Each has reached out to us and we've reached back, and there's a nice back and forth going. We understand that at this time we may not need to help each other a lot, but that we need to establish our dialogue so when someone asks for help, we can all jump in. We're also part of the LA County Emergency Management System, and that has been helpful in a way that I've never seen before, in the sense of both the hospitals and the city and the county, and the way they're coordinating is better than any time I've ever worked in the county since my arrival in 1994. The most important thing is that we're here standing by to treat the people who need it. And that is our challenge and also our mission. I'm noticing we have about 5 minutes left before we wrap up. And there's a few more questions that you have asked that I want to make sure get answered. So Anita, we have one question. Will your clinic help people who do not have insurance if they need care?
Yes, as always, we will see patients who do not have health insurance. Because we're asking everyone to be safe, we recommend they call us before coming in. But as we all know, at this time, we're seeing that a lot of people have very unstable employment situations, and that often means that they don't have coverage anymore. So that's why our health enrollment services are really important at this time, and we are well set up to help people over the phone or in person if needed.
Despina, tell us more about what our patients do when the clinics close and if they feel they're having severe COVID-19 symptoms.
We already have a structure where our clinicians are on call 24/7. And with that, this provides currently the support that our patients need. But I will mention here that over the last 2 to 3 weeks, we have seen a significant uptick in the number of our calls. And many of them, as you can imagine, are around COVID-19 illness or advice. What is wonderful about being able to work remotely and have the tools to do it with the laptop is that when our providers speak with the patient, and if the patient is a suspect to have COVID-19 and can only and does not need to go to the ED and can be managed at home with advice, we're able to send those patients educational material through the portal. So they know how to manage their disease, they know how to protect themselves and also protect their loved ones, because we have specific instruction when a patient is living with other family members, their close contacts need to also serve quarantine for 14 days. So those are very helpful tools, and it's important that we play this important role in our community to decrease the transmission of COVID-19.
And Anita, are people who are victims of intimate partner violence more in danger at their homes due to shelter-in-place orders? And how can the clinic help these people?
Yeah, that's a great question. And actually, our Director of Behavioral Health, Mimi Lind, recently sent out some information to providers about this, that as you can imagine, if we are all supposed to be sheltering in place, safer at home, that these folks might not be. So in a typical situation, they, for one thing, it's a very stressful time, and often that can escalate abuse, but also they don't necessarily have a break from the person who might be abusing them. They might not have as ready of an excuse to pop it out and run an errand when they're actually trying to seek help. They might not have privacy to make a phone call. And so it's important that we keep that very high on our radar. We're fortunate we have a very robust behavioral health program, which also includes a dedicated domestic violence counselor. And they're available both on the phone and in person. And one of the other things that Mimi did was that she actually gave some tips to everybody, all of our providers giving care, to remind them of that and say that there might be situations in which you have to be more aware of the need for privacy. So, you know, to ask them yes, no questions and understand that they might not be able to speak as openly.
I want to wrap up with a question that I'm very grateful for whenever I hear it, and that is, how can people help? Our low-income patients are facing even greater financial struggles from the pandemic, and we are setting up Amazon wish lists to help them access supplies they need, like school supplies, arts and crafts, baby wipes, and diapers. Stacy Scarborough at Early Head Start managed to get a truckload of diapers that were delivered to the doorsteps of all of her clients, and they were badly needed. We have ways that people can volunteer and still practice social distancing, like helping with food distributions or crafting cards and messages for our patients. If you or your families or groups of friends are interested in participating in any of these activities, go to our website and send us an email. Also, each of us is happy to talk with you. I miss seeing your faces, I miss our interactions, and our Zoom network works really well, so we could set up lunch dates and dinner dates and tea and coffee and dessert. And if you don't want to eat, we can even do walking dates with you over Zoom. So we'd be excited to do that. Your donations are welcome now more than ever before. The funds you provide us with are helping us provide continuity in our healthcare and mental health care, provide our patients with the basic needs of food and housing and hygiene, and protect our frontline healthcare workers. So you can make a gift at venicefamilyclinic.org/COVID-19. I can't thank you enough for joining us today and supporting us. and letting us know each day that you're with us and you understand how difficult it is for all the work that is going on right now. Please be safe, stay well. We're going to say goodbye, and we'll miss you till we see you next time. Thank you. Bye-bye.